are called golden moments. How any one of us can save an accident victim or somebody who is in an emergency. It is called the CPR. So all our students have undergone the training. They will demonstrate to you how important it is. It is a life skill that is very, very important and the need of the hour. If you undergo this training, you will be able to save anybody's life during the critical moments of an accident or a heart attack. Here we go. I request sir to speak a few words.
Pulmonary resuscitation, the technique used to save the life of a person who is in a cardiac arrest. This is usually done when a person is unable to breathe normally and when a person falls down without any response. We have an act how the CPR works. So we have one Rakshan Abhay and his teams. These two guys are friends. After waiting along, they are going on a ride. So Rakshan felt dizzy and he has collapsed. So when a person collapses, the first step of a CPR is to check the response. Call for a name or check for his name. When the person collapses, the first step is to call for his name and check for the response. Second step is to check his pulse and if possible call for an ambulance. Using both of your hands, keep your hands on the chest in the middle part of the person. Give 100 to 120 compression per minute and for every 30 compression check his pulse. If possible, do this same steps until an medic or ambulance arrives. The important thing about the CPR is stay calm and focus. Even if you are unsure, doing something is better than doing nothing.
If there is heart stops, so when the heart stops or breathing stops, like so your brother did one thing. So he checked this. Pulses. How do you check the pulse? You're not a doctor. You should, you should hear to his nose whether he is breathing or hold your ear to on his chest and see whether breathing is happening. Just do that. Hold your ear on his chest. Which side of your body is your heart? Your left side, isn't it? Your left side. So, your heart is towards your left side, isn't it? Okay, so you should check whether there is breathing happening. So place your ear on the left side and check whether the person is. Come on, baby, come on. The next one. You. Yeah. Sit down here. You're in the assembly and you're talking. Nonsense. Please calm. Sit down. Please sit down. Look at his nose. Just keep your ear near his nose and see whether he's breathing. So if breath is not breathing, then you're supposed to do the CPR. CPR is cardiopulmonary resuscitation. Resuscitation. Okay, what you're supposed to do is, you should look how your brother does. You should hold your left palm front, left you lock your fingers this way. This way. Stretch your right hand first. Left hand front. Left hand. Stretch your left hand. And right hand above that. Lock it up. Lock it up. Lock your right hand. Lock it. And do not bend your elbows. Stretch your left hand. Lock your right hand. And you should lock your elbow. And hold on the chest, center of the chest. Then start compressing. Rhythmically compress. Look how your brother is doing on the chest. Should not be either fast nor slow. It should be per second 2 pushes. Okay, your elbow should be locked. Your elbow should be tight. And for every 30 compression, you should see whether the patient is, the person is breathing or not. 30 compressions. It should be hard. It should be hard. Yes, 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 yes. Wait. So check it if required. You would have seen in the cinema, they give oxygen through the mouth. That may not be required. It is only fancy in cinemas. But if the lungs have stopped breathing, if you stop breathing for after 30, pushes, you should open the mouth, close the nose, and start, breathing, putting the oxygen inside his lungs so that he gets enough of oxygen. So that it's a life saving. It may be laughing to you, some of you. But you're saving a life, you're making a huge difference. Maybe it be, your family members, if something happens to family members, so you should be equipped. So how does CPR is done? Hold your left hand on that, lock the right hand and do not bend your elbow. Then where do you place your arms? Palm on the middle of the chest, and look how brother has kneeled. So you should go on giving the pressure. Yes, yes. How many you should give? 30 pushes. For every 30 pushes, take a deep breath in. Look, so you have made a difference to that person. Look, he was able to. The heart started, because suddenly the heart stops. If you give that shocks, heart would definitely research and it may start functioning. So it's important that CPR, if anybody in your family, if you find, they have some mild heart attack or they've fallen down, but if they're unconscious, you should not do this. If they're unconscious, they will be breathing. Okay, don't do this. If they're unconscious, they will be breathing. That's why you're supposed to check their pulses, whether the person is breathing or not. So how do you check it? You should hold your ears, here is heart, so you can see the heart is pumping. So, and here is nose, you could feel that he is breathing. That sound would be there. So this is what, this procedure is what? What procedure is this? What procedure is this? Okay. So this is the first step. If at all, before calling the ambulance, if at all you do this, within the minutes of a person falling down or has a mild heart attack, this procedure has made a difference to many people. Many who had cardiac arrest were saved by this procedure. I think you would have seen it on many videos also. So, yeah. Yes. And how are you supposed to keep it? If he lies down, so people should not, crowd around him. You should give enough of space so that there will be fresh air. And you should make his chin. You should make his chin proper, lie proper, so that he gets the fresh oxygen. So you should properly laid down on a flat surface. Okay, first step is the person should be made to lie down on a flat surface. That's more important. Get it? Okay, thank you. So that's wonderful by Nigerian brothers. They presented through a case. Good work.
I am studying in grade 9. My topic is about CPR. CPR is also known as cardiopulmonary resuscitation. This can help to save a life of a cardiac arrest. When the heartbeat stops or it beats rapidly, then the person will fall down. So please use this CPR technique what our grade 9 students taught us. There are 5 reasons to learn about CPR. First reason, CPR can save lives. CPR protects from brain death. CPR is also helps in families like elder ones and patients. Anyone can learn CPR and makes people safer at home. Thank you.
आज मैं CPR के बारे में कुछ बात बताना चाहता हूँ। CPR या कार्डियोपुल्मोनरी रेस्टिकेशन किसी व्यक्ति को कार्डियक अरेस्ट से बचाने में मदद कर सकता है। CPR भले ही आपको CPR ना आता हो, सिर्फ हाथों की मदद से आप CPR का इस्तेमाल करके किसी व्यक्ति की जान बचा सकते हैं। व्यक्ति के बचने की संभावना को और बचाने की संभावना के लिए आपको तुरंत कार्रवाई की जरूरत है। CPR से ऑक्सीजन युक्त रक्त बहने के लिए प्रवाह करता है और CPR की मदद से मौत से बचाया जा सकता है। धन्यवाद।
ನಾನು ಅಭಯ್ ಸೂರ್ಯಾಪಿ. ನಾನು 9ನೇ ತರಗತಿಯಲ್ಲಿ ವ್ಯಾಸಂಗ ಮಾಡುತ್ತಿದ್ದೇನೆ. ಇವತ್ತು ನಾನು ಒಬ್ಬ ವ್ಯಕ್ತಿ ಹೃದಯಾಘಾತದಿಂದ ಕುಸಿದು ಬಿದ್ದಾಗ ಅವನ ಪ್ರಾಣವನ್ನು ಹೇಗೆ ಉಳಿಸಬೇಕೆಂದು ನಾನು ಇವತ್ತು ತಿಳಿಸಿಕೊಡುತ್ತಿದ್ದೇನೆ. ಒಬ್ಬ ವ್ಯಕ್ತಿ ಹೃದಯಾಘಾತದಿಂದ ಕೆಳಗೆ ಕುಸಿದು ಬಿದ್ದಾಗ ಅವನಿಗೆ CPR ಎನ್ನುವ ಚಿಕಿತ್ಸೆಯನ್ನು ಮಾಡಿ ಅವನ ಪ್ರಾಣವನ್ನು ಉಳಿಸಬಹುದು. ಧನ್ಯವಾದಗಳು.